Hello, and welcome to Breathe In, Breathe Out, Tips for Modern Parents, brought to you by Sanofi, the maker of Beyfortus.Nirsevimab-alip 50 milligram and 100 milligram injection. A preventive antibody that can help protect your baby against serious RSV lung infection. It's for babies under 1, born before or during their first RSV season, and certain kids up to 24 months. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Stay tuned to hear more important safety information about Beyfortus throughout the podcast. I'm your host, Kimberly Justice. On this podcast, I'm going to be talking with parents and healthcare providers about navigating that first year of your baby's life. So that's from illness and sleep to helping parents feel empowered as new parents. So along the way, we hope to create a sense of community. We hope to create some connection with everyone so that you feel supported through your journey to raise a happy and healthy child. Our topic today is parenting in the age of social media. It's a lot, but we're going to get into it. So a little about me. I'm a nurse, I'm a radio host, and I'm also a mother of 2. And like all the parents out there, I've definitely seen that social media, it can have benefits and it can have some pretty big drawbacks as well. So I'm excited to dig into this topic today and share it with our guests. So joining me on the panel today is Dr. Brittany Odom. Now, she's a board-certified pediatrician. She's a wife, mom, who was trained at Johns Hopkins All Children's Hospital. Dr. Odom currently is working in Mississippi, both at a clinic and seeing newborns in the hospital. So welcome, Dr. Odom. It's nice to meet you.
It's so good to meet you guys, and I'm so happy to be here. So happy to talk about this stuff.
Also with us today is Lane. Lane is a mom of a 5-year-old boy. She's got a 2-year-old girl. She works full-time, lives in Portland. She is a very busy lady. Welcome, Lane.
Thanks for the validation, Kimberly. Appreciate that. Great to see you. Thank you.
Yeah, I am here for you. The Breathe In, Breathe Out podcast is sponsored by Sanofi. All of the guests on the podcast are being compensated for their time. So, Lane, let's start with you today. What would you say are some of the dangers of social media for new parents?
You know, I think to me, what pops to mind is just the fact that no one on the internet can know your child. Mm-hmm. So even if we have, assuming the best of circumstances, good intentions, anything you see online, comments, suggestions from people, they may not apply to you because they don't know your child. They don't know who your child is, what needs they have. I think that's really something that pops to mind for me. I think the other risk that I always think about too is that truly, you can find anything online to confirm what you're looking for. So if you have an idea or a thought a certain way, you can find that. You can find that online somewhere, which I think makes it very risky in some ways.
Absolutely. So Dr. Odom, I want to bring you in. We all know the internet can expand our world in useful and exciting ways, but kind of like what Lane was saying, it can also expose us to a lot of bad information. So what kind of advice do you give parents that are concerned?
Oh my goodness. So Lane brought up some excellent points, and to kind of piggyback off what she was saying, the biggest point that she was kind of making is what we call confirmation bias. So again, finding this information online that just further validates what you're thinking and feeling. So being very careful about what you're searching and who you're getting this information from is extremely, extremely important in this world of social media. Checking the credentials. So who is this person that's telling you these things? Is it somebody that's had, years and years of training? Is it somebody that just decided yesterday that they're going to be the expert and call themselves an expert? Is this someone that's trying to sell you something at the end of the day? So figuring out who is this person? What is their motive? Is it truly just to educate you, or is it to get you to, buy into something that they're trying to sell you, whether that's an idea or an actual product? But what is their motivation? What are their credentials?
Yeah, finding those sources can be really helpful when you're looking for that type of information. Lane, I know sometimes it's not advice or information that parents are looking for. Sometimes you're just looking for support or an online community. What kind of guidelines have you set for your social media use?
Yeah, I mean, I think it's a great way to kind of interact with other parents, get some kind of feedback and thoughts. But I personally don't really take advice from anyone without checking their credentials. Seeing, just like Dr. Odom said, I think that piece has become really important to me. And I mean, there are sites where people use their real names. They have a profile picture. You can read about them. And if they have, credentials listed on there, you can look that up to verify, is that actually true? Is this person who they say there are? And you can see if someone posts something, you can check and see, is that backed up? Is that accurate? You can have a little bit more transparency on that front.
Mm-hmm.
That's a little bit of the risk with an anonymous forum, is that people can say anything. You can say you're anyone. You can say anything you want. You have no idea who that person is, right? You don't know anything about that. So I take things a lot more with a grain of salt for that reason.
Sure.
It can be nice for support, but you have no idea who someone is. I also would say as well, just to add, that if anyone ever says something super dramatically, that's always a red flag. So if somebody says like, well, you have to do this, like this is what every kid needs, or you can't ever do this, that to me is like, oh, I don't know about this. This seems like we're on rocky territory here.
Yeah. Or I personally have noticed if the clock is ticking,
no, of course, yes,
if they set
urgent.
that kind of boundary, it's like maybe it's not so urgent. So, Dr. Odom, as far as kind of putting on your pediatrician's cap, how much do you hear, and are you hearing in your practice from parents about medical issues that they see online?
I want to say every day, and I really feel like that is probably the case. At least once every day, there's, somebody saying, I saw this online, or they pull out their phones to show me the TikTok of the product that they're debating buying for their kid. And they ask me, is this okay? And they're pushing the phone in my face. So there is a lot of that. And I love that, though, because that makes me feel as if, okay, my parents and my patients are comfortable bringing this stuff to me.
Sure.
I don't want them to feel ashamed that they saw this on social media. We are all seeing it on social media. So it's not a bad thing. We're not going to look at you crazy because you said you saw it on Facebook. We're all seeing it. So I would rather you bring it to me. I would rather you show me what you're seeing and kind of run it by me if you're comfortable doing so, because we can kind of give you another set of eyes, another set of, some experienced perspective when it comes to these things too. So I see it all the time in my experience. So yes.
Sure. Yeah. And I know, I'm certain as a healthcare provider, you want parents to feel empowered to ask questions, and they are engaged and they're trying to educate themselves.
Absolutely.
That is a positive.
Absolutely.
So how do you advise parents on using social media, specifically though, for those healthcare concerns? Because I know, every parent's done it. Right. You're up late at night, you're Googling symptoms.
Yeah. No, that's a great question. So I want to say not all social media is bad.
Sure.
Right. So we're doing a lot of talk about all the bad things out there and the places you can find misinformation. There's a lot of that, but there's also a lot of good. There's a lot of sources online that can give you really good information, especially in a pinch when you need it and you can't call your doctor's office. Mm-hmm. So I try and kind of guide parents towards those sources, like the American Academy of Pediatrics, who has an Instagram page, and I believe they may have a TikTok. I'm not sure, but they are trying to have more of that face online and social media too. Healthy Children is also a great resource as well, and they have a really good Instagram too. But they're also putting out lots of information, health-related information for parents that helps parents kind of in those, situations you were just mentioning. We're in a pinch at 3 a.m. and I need to know,
right.
Tell me about flu right now. What do I need to know about it? And if you're going to Google something, try and click on the site that is a reputable site. So like the AAP or the Healthy Children or the CDC or something that has some credentials behind it that you're getting this information from. Probably not the best option is to click on somebody's blog where they're telling their one story about their 3-year-old 20 years ago. So just trying to think about who am I getting this information from? And there are a lot of good organizations that are putting out good information online.
And I don't know that a lot of people realize you can look up a lot of that licensure stuff online. It's available. It's public information.
Absolutely.
And yeah, feel free to check that stuff. Lane, do you have an example for us of you going on social media for healthcare information?
Yeah, I don't go to social media to look for information on symptoms per
Mm-hmm.
se, but what I'm looking for more is kind of generally healthcare content that I consider maybe useful to me. So like something, for example, like if there's a certain illness that's on the rise, like when we're at the onset of RSV season, if there's a hit of norovirus or something like that, I like looking for that kind of information from people who are in a position to know about those kinds of things. I also will look to it occasionally for kind of some of those what if scenarios, like if, pediatricians, maybe like Dr. Odom, are posting like, hey, here's a situation about when you take your child to the doctor. Like, let's say your child has a fever. What are some markers that would indicate when you need them to be seen? I look less for kind of a specific symptom and more for like, okay, what are kind of markers for when I might need
Uh-huh.
more support? And again, I'm really looking at qualifications on that front to make sure that that's accurate, because that stuff is important and it could be dangerous if the information's not
Yeah.
right.
Yeah, that's really helpful information to kind of know what's literally in the air
Yeah.
and what's going around. So,
Mhm.
Dr. Odom, let's talk a little bit about RSV, or respiratory syncytial virus. Parents are very likely to turn to social media for advice. So, just tell us, what is RSV and what are the symptoms?
So RSV, it's a virus that starts with symptoms that are similar to a common cold. So runny nose, coughing, maybe a fever. With RSV, while most cases are mild, it can get worse and it can peak at day 4, day 5, possibly progressing to wheezing, being very congested, lots of coughing. Sometimes we can even see oxygen levels start to drop from this too.
And as I said earlier, this podcast is sponsored by Sanofi, which makes a preventive medicine to help protect infants from getting serious RSV lung infection. Dr. Odom, could you explain what that is and how it works?
Yeah, so it's called Beyfortus. It's a shot that your baby gets in the first year of their life. So an additional dose of Beyfortus may be needed for children up to 24 months of age who remain at increased risk for severe RSV disease in their second RSV season. For children that are undergoing cardiac surgery with cardiopulmonary bypass, an additional dose of Beyfortus is recommended as soon as the child is stable after surgery. And Beyfortus may not protect all children.
And how does it work?
Yeah, so Beyfortus is an antibody to RSV. So that means if your baby comes into contact with RSV, he or she will already have the tools that they need to help respond to the virus. So this can help prevent RSV from turning into a serious lung infection.
Lane, it was actually a post about Beyfortus that you made in an online forum that led to you becoming a Beyfortus ally for Sanofi. So, can you tell us what you decided to post about in the first place?
Yeah, I'm in a forum of parents whose babies were born the same month as my baby. We call it a due date
Mm-hmm.
group. It's been incredibly supportive. I've made some real life friends. We have met in real life now. It's a wonderful, wonderful community. There was a mom in the forum who had said, "Hey, my pediatrician brought up Beyfortus. Does anyone know about this? Anyone heard of it? What are kind of your thoughts?" And I was quick to respond to that.
Gotcha, of course. So, Dr. Odom, what are the kinds of questions that parents have for you about Beyfortus?
They have a lot of good questions. So their first question usually is, when do I get the shot? And then what is the timeline for all of this? So it depends on where you live in the country, but RSV season usually begins around November and ends somewhere around March.
Mm-hmm.
So as far as getting the Beyfortus shot, you want to get it during the RSV season. They also have questions about how long the effects last for. How long is this Beyfortus shot actually good for? And that's a great question. So that's usually about 5 months or so, and that'll get you through a good chunk of RSV season. And then, of course, what are the possible side effects? So while serious allergic reactions have happened, the most common side effects are rash and pain, swelling, or hardness at the site of the injection.
So, Lane, clearly you had some concerns about your baby getting RSV. What were your fears?
I think like any parent, I had concerns that my child would get sick, and more importantly than that, the fear that it would become an emergency,
Mm-hmm.
that it would become something that was urgent and needed critical attention, and that she could end up in the hospital needing that level of care.
Yeah. So, Dr. Odom, what are the risks to newborns who do get RSV?
Yeah, so the biggest risk that we see, especially for our young babies, is running into trouble with breathing, so the respiratory system. So this can cause their oxygen to drop, requiring oxygen masks and nasal cannulas and having to have breathing treatments. It can require them to stay in the hospital for an extended amount of time. I worked in New Mexico before I was here in Mississippi, and that was during one of the worst RSV seasons that we had seen. And there were numerous babies that we had to roll out the oxygen tanks for in our clinic just to get their oxygen levels to come up while we waited for the ambulance to come and get them. So it's not something that we mess with or play with at all.
Absolutely.
We take it very seriously. Yeah, and it can be very scary. Even the mild cases can be scary for moms and for dads that are caring for these little ones.
Yeah, the thought of little nasal cannulas and masks on those little faces, that's not something that anyone wants to see, but especially parents. And I'm sure the first thing a lot of them would do is run to social media to get support or maybe some more information. So pivoting back to that topic with social media and how it plays a role in parenting today, do you think it'd be beneficial for pediatricians to talk with parents rather about social media literacy around healthcare information?
Absolutely. Yes. Especially as time goes on and social media plays a bigger and bigger part in our lives and our daily lives. I think pediatricians and parents talking to each other about what they're seeing and being more of a collaborative effort and taking that information, deciphering it, and applying it to their child's care is important. It's super important. So if you are a mom, if you are a dad listening, bring those concerns and those questions to your pediatrician. They should not be judging you. And if you feel judged, find a new pediatrician. This is a conversation that needs to be had. So you want to be comfortable talking with them about the things you're seeing and being able to come up with a plan moving forward with those things.
Yeah. Lane, what about you?
I completely agree. I mean, I think it would be tremendously helpful for pediatricians to have that conversation with parents about social media literacy and how to navigate that. I think it could really, really help for parents to be able to kind of double check and vet the things that they are reading online. Like I said, I found online forums really helpful for support, getting some ideas, feedback, kind of sharing thoughts, like telling that mom I had a discussion with my baby's doctor about Beyfortus, for example. But in general, when it comes to decision makings, I always defer to going to my pediatrician for that.
And I would encourage all parents of infants to talk to their child's healthcare provider about RSV and Beyfortus.
Thank you both so much for joining us today. Lane, a pleasure talking to you. Thank you for your time.
Thank you so much for having me. It's so great to have this conversation with both of you.
And Dr. Odom, so much terrific information. We really appreciate it.
Absolutely. This was so much fun. Thank you guys for having me.
And you can find Dr. Odom on Instagram at Dr. Britt Odom, and that's Dr. Brittodom. To hear all the episodes of Breathe In, Breathe Out, go to the Beyfortus website. That's Beyfortus. I'm Kimberly Justice. Stay tuned for full important safety information. Important safety information. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Before your child receives Beyfortus, tell your healthcare provider about all of your child's medical conditions, including if your child has ever had a reaction to Beyfortus, has bleeding or bruising problems. If your child has a problem with bleeding or bruises easily, an injection could cause a problem. Tell your healthcare provider about all of the medicines your child takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Your infant should not receive a medicine called palivizumab if they have already received Beyfortus in the same RSV season. Serious allergic reactions have happened with Beyfortus. Get medical help right away if your child has any of the following signs or symptoms of a serious allergic reaction: swelling of the face, mouth, or tongue, difficulty swallowing or breathing, unresponsiveness, bluish color of skin, lips, or under fingernails, muscle weakness, severe rash, hives, or itching. The most common side effects of Beyfortus include rash and pain, swelling or hardness at the site of your child's injection. These are not all the possible side effects of Beyfortus. Call your healthcare provider if you have questions about side effects. Indication: Beyfortus is a prescription medicine used to help prevent a serious lung disease caused by respiratory syncytial virus, RSV, in newborns and babies under 1 year of age born during or entering their first RSV season. children up to 24 months of age who remain at risk of severe RSV disease through their second RSV season. Please see accompanying links for full prescribing information, including patient information.